Avail. We do have
Recording
a
in
Spanish
progress.
language interpretation channel, as well as an American Sign Language channel, excuse me, that you can click over to for translations. Also, you can customize your view between the slide presentation and the speakers by using that gray slider bar. You can slide that to the left and the right, and that will allow you to be able to see some different views if you're recording or if you're looking to get some screenshots of that. And also remember too that any topics that are not covered today on the Media Avail, you can always email us those questions at media_info@state.co.us. We have two panelists today for our media update, Dr. Rachel Herlihy, the state epidemiologist, and Scott Bookman, our COVID-19 incident commander. Dr. Herlihy, I will send it over to you to get started.
Great, thank you so much. Good afternoon, everyone. So starting here with our weekly case counts, daily case counts, what you'll see in this figure is our daily case counts shown in those gray vertical bars, and then our 7-day moving average shown in red. You'll see that in the last week or so, we have seen a slight decrease in cases. At this point, this is the same scenario that we're seeing play out in US numbers overall. It's an unclear trend to me at this point. We don't really know where this trend is heading. It's certainly an early decline in cases. And so I want to urge some caution in interpreting this decline that we're seeing. I'm feeling pretty uncertain right now if we are going to see a plateau, see a decline, or potentially see an increase once again in cases. So we are certainly going to be watching this data closely through the week this week and into next week to see if we continue to potentially see a decline or if things are going to look more like a plateau or unfortunately increase again. I think we're really uncertain right now in where things are headed. Next slide, please. So looking at our age-specific trends in the state, and you'll see that different age groups are shown in different colors in this figure. You'll see our school-age kids are shown in the top two categories here. So 12 to 17-year-olds shown in orange, and then in teal, we have our 6 to 11-year-olds. Those two age groups are the age groups where we're really seeing the highest rates of disease transmission still in the state, followed by the adult population and the 0 to 5-year-old population. We are seeing, though, that the decline that we've seen in the last week is occurring among all age groups at this point. So it does appear to be consistent across age groups. Where we are seeing more variability, though, is across the state. So we know that throughout the pandemic, different communities in Colorado have experienced peaks and valleys in transmission at different times. And that's certainly the case today, too. We have some communities in Colorado where rates continue to go up, others that are seeing a plateau, and others where we're seeing a decline. So this statewide picture doesn't necessarily reflect what we're seeing in every community in Colorado right now. Next slide, please. When we look at our hospitalization data, just over the last couple of days, you can see a little bit of a stabilization in hospitalizations. I wouldn't say we're yet seeing a plateau, certainly not a decrease, but perhaps a slowing of our increase in hospitalization. So this could be an early sign that things are improving both in our case data and our hospitalization data. Again, we'll be watching this closely throughout the week this week and into next week to see where the trends are headed. I will certainly feel better about interpreting our case data as a real change in trend, a decline. If we start to see our hospitalization data plateau and begin to decrease, that will represent to me a clear indication that things are starting to improve here. But at this point, we are continuing to at least see a gradual increase in hospitalizations. Next slide, please. Since the beginning of the pandemic, we have seen this trend where the vast majority of our hospitalizations are occurring among our adult population, and that continues to be true now. You can see that 886 of our total hospitalizations currently are among adults, with a small number, 12, among our pediatric population. And you can see those pediatric trends more closely in the next slide. So here you can see the difference between the 0 to 11-year-olds and the 12 to 17-year-olds. In general, we're seeing a gradual increasing trend still. You can see that we have a day or two of declining trends in our pediatric hospitalization numbers here. But again, they're pretty small numbers and bounce around quite a bit. But if you draw a diagonal line really from the bottom left-hand corner of this figure to the upper right-hand corner, you can see that there is a clear, gradually increasing trend. Again, we'll be paying close attention to these numbers to see if we start to see them stabilize or perhaps decrease in the next couple of weeks to come as we see some of those case trends also stabilizing. With that, I'll hand it over to Director Bookman.
Thank you, Dr. Hurley, and thank you all for joining today. Wanted to pull this graphic back out again for everyone to see. Our most recent update, as Rachel indicated, is that we have 898 people hospitalized today with COVID. 745 of them are not vaccinated. Only 153 vaccinated people are currently hospitalized. I want to emphasize again, the stress that our healthcare system is currently facing is because of those who are not vaccinated and who are winding up getting COVID and winding up being hospitalized. Next slide. So we obviously have been carefully monitoring all of our hospital system metrics over the last few weeks, months, and over the course of this pandemic. And as Dr. Hurley indicated, we are cautiously optimistic that we might be seeing the beginning of a plateau in the hospitalizations that we are seeing each day in Colorado. As of today, approximately 85% of ICU beds across the state are currently occupied. Almost 80% of our medical surgical beds are occupied. That number has obviously increased over the course of the last 30 days. We've seen an 8.2% increase in our ICU bed utilization in the last month alone. On the positive side, our pediatric ICU and neonatal ICU beds have remained incredibly stable since we began monitoring those metrics. And as of today, we have 26 pediatric ICU beds and 205 neonatal ICU beds available. We continue to monitor ventilator status. Early on in the pandemic, ventilator utilization was a metric that we're watching closely. At this point, we have a significant supply of ventilators available in the state and are not anticipating any kind of supply issues on that side of things. So that was the update that I wanted to give today. And I think, Brian, I'll turn it back over to you.
Right, thank you, Dr. Hurley and Director Bookman. We're going to open it up to media Q&A here. Just a couple of reminders. We're going to use the raise hand function. If you'd like to ask a question, go ahead and raise your hand here within the Zoom app, and we will call on you in the order that those were requested. And let's start with first questions first, so we can make sure we get through everybody's first questions. If we have time, we can circle back with some second questions and follow-ups. And please make sure that you don't have any tabs auto-playing when it is your turn to ask a question. And before you ask, please do offer your name and outlet. And again, please email media_info@state.co.us for any inquiries on topics that were not covered in today's press conference. Let's go ahead and start with Cindy.
Hi, Cindy Santafonte for KRDO News Channel 13. I live in El Paso County. I'm working on a story currently regarding our positivity rate. According to the state data that was posted on the website, our positivity rate today, as of a year ago, was around 2.2%. And as of today, it shows that it's averaging roughly 9%. I also see that El Paso has the highest number of cases tracking since the start of the pandemic, overlapping Denver. So given that data, where is El Paso headed? Should we be concerned about these trends that we're seeing currently?
I can certainly take that question. So we are seeing quite a bit of variability across the state right now, as I mentioned. In the Denver metro area, we are actually seeing a little bit more of a stable trend or a declining trend, but El Paso County is a place where we are seeing a continued increase in cases right now. So things are a little bit different there. One thing I would caution in comparing data from one point in time or one community to another, it's important to remember that we're not going to expect this pandemic to play out with waves of illness occurring at the same time this year as they did last year, or in one community at the same time another community might experience a peak in illness. So there is going to be quite a bit of variability, I think. So just keep that in mind when you're looking at what's happening in September this year in El Paso County compared to what happened in September last year in El Paso County. So I think those are just some thoughts in trying to interpret the data and what might be happening right now.
All right, let's go to Meg.
Hello, this is Meg Wingeter from the Denver Post. Can you hear me all right? Okay. I wanted to ask about with hospital capacity. Obviously, we're also heading toward flu season and such. Is there any? I know last year there wasn't much of a flu season, but is there any concern that this year we could be dealing with that on top of everything with COVID and all the other things that are straining the ICUs?
Rachel, you want to take that one?
Sure, I can start if you want to add in then, Scott.
Perfect.
So again, this is another area of uncertainty. We have an example of another respiratory virus, the RSV virus, that we are seeing a pretty rapid increase in right now. And so what we don't know is influenza going to behave the way that RSV is behaving right now, or we're seeing earlier transmission, high levels of transmission of that virus, or is influenza going to be different? We know that the Southern Hemisphere, at least so far, hasn't experienced a significant increase in influenza transmission. But that doesn't always predict what happens in the Northern Hemisphere. So I think at this point, there's a fair bit of uncertainty about what could happen with flu this year. But you're right in that if we were to see play out a severe influenza season on top of severe rates of increasing hospitalization due to COVID-19, that could certainly put strain on our healthcare system. And I think that's a really important reminder of the importance of influenza vaccination and why we want Coloradans to start getting influenza vaccines. Now is the time to start getting those doses of the influenza vaccine to make sure that you're fully protected for the influenza season that's coming.
Right. Is that John Daly?
Yes, it is. Yeah, thank you for taking our questions today. Question about dashboards and some variability there, kind of school district by school district. How important do you think those dashboards are for parents to understand what's happening in their school districts? What do you think of districts that are not posting information on their dashboards or scant information? And then what can and is the state doing to either encourage or require school districts to post some of that information on their dashboards?
Well, I think that, top line, it's really important for everyone in Colorado to have information to make the best decisions possible about how we go forward in this pandemic. And so we encourage everybody to be consumers of our data. We would encourage local jurisdictions, we would encourage school districts to provide as much data as possible so that parents, so that teachers, so that members of the general public can make the best decision possible for how they live in the state that we're currently in.
All right, Chris.
Chris Van Veen with 9 News. I'm looking at your pediatric cases, and I'm wondering if there's any messaging for parents today. Obviously, there's been a lot of concern with schools reopening. We know there's a lot of cases that are scattered around, but so far, it has yet to translate to any real substantive increase in hospitalizations. Do you have a message for parents that are still concerned and maybe for very justified reasons, how they should view that hospitalization data?
Yes, so I can add to that, and then Scott, feel free to jump in if you have additional comments as well. So, we know what works to decrease the risk of disease transmission. We know that masks play a really important role in decreasing transmission. We know that masks are important in school environments, but also outside of school environments. And that's both for kids and for adults, especially those that are not vaccinated. And obviously, children under the age of 12 years old are unvaccinated at this time. And so I certainly urge parents to have their children wear masks in school, but also have their children wear masks out of school when they are in indoor public places. We know that the risk to children right now is higher than it's ever been during the pandemic because of the Delta variant being more transmissible. And so I think it's important for parents to have that information and make sure that they are following public health guidance on how to best protect their children right now.
All right, Brianna.
My name is Brianna Jett. I'm with the Gazette. I was wondering if you have received any guidance from the federal government on how the vaccine mandates are going to roll out, and are we ready for those?
Scott, I will try to take that question. And the short version is we're still waiting to hear from the feds exactly how these mandates will be implemented and regulated. And we'll be working with our federal partners to get that information. And again, I will take this moment to just reiterate that the reason vaccine mandates are going into place is because of the importance of getting this vaccine. And so whether you're mandated or not, the key to us returning to our normal lives is to get this vaccine. And while we may all be done with this virus, it is not done with us.
All right, Vinny.
Thank you. This is Vinny Del Giudice at Bloomberg News in Denver. Variant question. I know the Delta variant is dominant. What other variants are you seeing now? Anything new creeping into the picture that you're worried about? Thank you very much.
Yeah, great question. At this point, we really continue to see the Delta variant dominate here in Colorado. Last week, our data showed that 100% of what we had sampled that was circulating here in Colorado was the Delta variant. This week, I believe it's more than 99%. I know that this week we saw very small numbers of the UK or Alpha variant, and then the other two sublineages of the Delta variant. So really at this point, we're not seeing other variants get a foothold here in Colorado. I know we get questions frequently about, numbers we're seeing for the Mu or Lambda variants, and we have seen sporadic cases of those, but it doesn't look like they're really increasing in the state at this point, really just sporadic cases.
Thank you very much.
All right, Chris.
Sorry, I'm cheating, but I think we've gone through everybody. I want to get an idea. There's a number of smaller rural medical systems, hospitals, providers, particularly in the southeastern part of the state, that are now actively writing the governor asking for some relief from the exemption. They're saying that if we have to get rid of all these people, we're going to have some serious staffing issues in the not so distant future. I realize the mandate is sort of set in stone, but do any of these providers have any outlet for respite should they really be concerned? Because staffing is everyone's concerned about staffing now. And if we get rid of a lot of healthcare employees in the next few weeks, we're going to have an even larger staffing problem.
I'll take that one. Thanks, Chris. And we are evaluating our hospital capacity across the state, and then looking at it at the regional level. We've certainly heard the concerns about staffing associated with this mandate, and I can assure you that we did not take the decision to issue this mandate lightly. It is our responsibility as healthcare providers to ensure that we're doing all that we can to keep our patients safe, ensuring that we are minimizing the likelihood of transmitting this virus to those in our care is a top responsibility of healthcare providers.
All right. Thank you, everybody, for attending today. Thank you, Dr. Herlihy and Director Bookman, for this presentation. And one more reminder, if you have any follow-up questions this afternoon or questions about topics that we didn't cover on today's Avail, please feel free to email us at media_info@state.co.us. Thanks again for joining us, and have a great rest of your afternoon.